Well, Doc, I don't want to take too much of your time. I know I'm taking a lot of it, so thank you very much for doing this. I really appreciate this. The goal for today is to educate our listeners and try to get people to understand maybe some warning signs of like poor cardiovascular health. And I'd like to sort through, my results and be completely open and honest about them. And you can, really shed some light on what we saw, because I went in to see you because I struggled very much with my not conditioning, because I do that every day. But I found Dr. Juan through a dear friend who was raving about your skill set. And I said, "Who's Dr. Juan?" So I know who Dr. Juan is. He's a superstar celebrity doctor who helps everyone. He's very kind. He's very hardworking. He's super fit, and he wears very nice suits. But I want you to tell us who you are and tell us how you arrived in the place that you've arrived. Just a few minutes on your background.
Yeah. Well, listen, I'm first and foremost, thank you, Marc, for inviting me to do this with you. I'm originally from Puerto Rico, so I speak more Spanish than English, I would say. But I did my medical training in the United States. I left Puerto Rico in 2002. I came to the United States and I did my internal medicine training at UT Southwestern in Dallas. I then became a cardiologist. I did my cardiology training at Johns Hopkins in Baltimore. And when I was at Hopkins, I developed this love for cardiovascular prevention. As opposed to being the guy who's in the cath lab at 2 in the morning opening arteries, I figured very quickly that that was a repetitive behavior. In other words, I kept seeing people that were coming to us with a heart attack, but 2 years ago, the same thing happened to them, and they weren't changing anything about their lives. They were still smoking, or they were still not taking care of their diabetes and so forth. So I figured we need to approach heart disease from a preventative standpoint. So that's what I fell in love with. And I came down to Miami. I did a master's in public health as well at Johns Hopkins. Then I came to Miami in 2009 and started practicing cardiovascular prevention down here. What also happened in my career is that my passion for prevention also led me to TV and the media. So I became the chief medical correspondent for Univision. And that gave me a significant platform to talk to Hispanics and help Hispanics in everything, quite frankly, that relates to health, not only cardiac, but I talk about everything on TV. So my life is a mix between my clinical practice and my media responsibilities, basically.
Okay, understood. Awesome. And you do a lot. You do a lot with the media. You have a very big following. It seems that everyone I'm connected to seems to know you, and they do rave about you in the most positive way, because you're a wonderful person and because you're a very knowledgeable doctor and you're a very helpful doctor. Um, you know, you've been working with people, and you see all of your clients for, you're a general doc for a lot of people. Is that correct? But you also specialize in heart health, as you said. And so I guess I'd like to know, what is the most frequent challenge that you deal with when it comes to younger patients, if you can share that. I see a lot of poor habits in today's, I'm saying 20 something, 30 something year olds. What is the biggest challenge that you deal with
So,
nowadays?
Marc, the biggest challenge by far in that age category is that they are not thinking about preventative health at all.
Mhm.
They basically, you tell them about heart health, and they're like, okay, I'm 20, I'm 30, I don't have chest pain, I don't have shortness of breath, I don't have any issues, so I don't need to see a cardiologist. Unfortunately, what they don't understand is that coronary artery disease the plaque that forms in your coronary arteries that eventually leads to a heart attack, that starts forming in your coronary arteries in a very silent way. So if you have high cholesterol, if you are overweight or obese, if you have high blood sugar, hypertension, you don't exercise, you don't eat well, that process can already be on its way when you're 30, let's say, but it's completely silent. So if you are not looking for those risk factors, if you are not looking to see if you're already developing plaque, unfortunately, the first manifestation of the disease in some of these individuals is going to be a heart attack in their 40s. So if you want to prevent that, you obviously have to think about it when you're in your 20s and in your 30s, because this is a long-standing process. You need to try to decrease those risk factors to prevent that plaque from forming in the first place. And so it's very difficult to explain to younger people that they need to start working on that when they're 20s and 30s.
Of course. And, that's what brought me to, I'm certainly not in my 20s and 30s. I'm 46 years old. I'm very...
We're the same age, Marc.
Yeah, 46. I mean, but you look like you're on the cover of a fitness magazine. We use that joke often, but he actually does. And the first time I saw him, I said, man, this guy's so fit. I'm wondering what he does. And I know you lift weights. Tell us about your fitness regimen, your health regimen, and then that'll dovetail into me asking where I'm going with the next.
So listen, I believe in balance, Marc. I do 3 meals a day. My portions are usually well controlled. Food, I don't live to eat, I eat to live. And I think that's very important. I know people that all they think about is food. Yeah. And every single activity that they do in their lives is surrounded by food or associated to food and so forth. That's not who I am. I've been exercising since I'm probably 15 or 16 years old. I'm an endorphin junkie. I need it not only because of physical health, but for mental health. Every day, or at least 6 times a week, I spend at least an hour exercising. I do it on my own. I don't have a personal trainer. I don't do it with a group. I see it as my alone time. Once in a while, yes, I'll seek advice from people like you who know a lot more than I do about training and so forth. But I like to be on my own, listen to music, and spend a little bit of time not answering the phone, not talking business, not doing any of that. I sleep my 7 hours a night. I think that's something that people don't do. I enjoy life. I mean, you've seen me at Carbone. Yeah. I mean, I ate the pasta. I ate the veal parm. It's not like I'm there not eating what everyone else is eating, but guess what? I keep tabs on myself. If it's a Friday, I think you saw me on a Friday. If it's a Friday, I'm having the spicy rigatoni with veal parm. You better believe it that I have a very clear plan on how am I going to eat the next day and how am I going to exercise the next day. Because life is that balance. I enjoyed it. I'm not thinking about, oh my God, what am I doing? Am I going to eat this veal parm? No. You have to enjoy life too. I'm there with my friends, with my wife. I'm going to enjoy it. But I have that plan for the next day because at some point I'm going to have to offset those additional calories. And I don't have a problem with that. I understand that life is a balance. I meditate, Marc, 40 minutes a day. For sure, 20 minutes a day. I do transcendental meditation. So usually what they teach us is that you want to do 40 minutes a day, 20 minutes in the morning, 20 minutes in the afternoon. I try most of the time to do the 40 minutes. Sometimes I can't, but I always do the 20 minutes in the morning. Okay. That has helped me significantly. And I manage time very well. I mean, I have like 4 jobs. And so time management is one of the things that I pay a lot of attention to, because if you don't manage time well, then stress is going to creep in.
100%. 100%. And you even mentioned to me that even when I know you don't take a ton of vacations all the time, but when you do take time away, you even make it a point to make sure that you understand exactly what your options are in regards to training, and you get your training in every day. Is that correct?
That is absolutely correct. As a matter of fact, some people criticize me and say, "You're on vacation." And I say, well, I even have more time now to exercise, because what people don't realize is that for me, that's something I like.
Right.
Exercise brings me satisfaction. So if I have more time to do it, of course I'm going to do it. I think if you see exercise as work and as something that you don't like and you have to do it, a couple of things are going to happen. Number one, yes, you're going to go on vacation and you're not going to exercise. The problem with those individuals, Marc, is that they gain the 5 pounds or the 8 pounds, and then they try to come back and overdo it, thinking that they are going to lose the 7 or 9 pounds or whatever it is, and in the process they might get injured because they're not used to exercising that much, as opposed to, do some exercise while you have time on vacation. It's going to make you feel very good, and you're not going to have the problem of gaining the 5 or 6 or 7 pounds. So I think one of the issues that they face is that they see exercise as work. The other thing that they run into, absolutely, Marc, in my experience, is that when you see exercise as something that you're obligated to do or as work, the consistency is not going to be there, because we're all human, and at some point we're not going to withstand the pressure of having to do exercise all the time. So you are going to be one of those people that exercises for 6 months and then stops for 4, and then exercises again for 3, and then stops for 1 or 2. And as you know, that's just not ideal.
No, absolutely not. Consistency is king, as we always say. So I was experiencing, I train often my whole life. I'm a washed up athlete, many years, and I do a lot of cardiovascular training. The reason why I share this is because during my bouts of cardiovascular training, not when I train, but maybe in the evening, certain periods of the day, I was like, man, I feel like I might have a heart issue. And what I realized is, if you have any issues, if you have any thoughts or any concerns, you have to see someone. So I was sent to Dr. Juan, who's the best of the best. And when we met, I explained I have some concerns, and you immediately put me through your testing protocols. Do you want to explain how you would, deal with a client like myself, and then we can get into the test results?
Yeah. So basically, there's certain things that we want to understand. Number one, what are the risk factors? That's just a conversation between me and, in this case, you or me and the patient. I need to understand whether you have a family history of heart disease. I need to understand whether you have diabetes, high blood pressure, high cholesterol, whether you smoke, do you exercise, do you not, what's your weight. Then I do a physical examination. You can pick up a problem, obviously, when you do a physical examination. And then once you have risk factors, you talk to the patient, you do the physical examination, there's one important question. Remember at the beginning of this conversation, I said, plaque in your coronary arteries is going to develop in a silent way. So if you don't look for it, you're going to miss it. So then what I do is I do an ultrasound of your heart to make sure that the heart is functioning okay. But then I do 2 other studies that are very important. I do an ultrasound of your carotids to see if you are developing plaque in your carotid arteries. And then I do what's probably the most important test in terms of predicting your risk of having a heart attack, and that is called a heart scan or a coronary calcium score. It's basically a CT scan from here to here. It's a CT scan of your heart, and it allows me to see if you are developing plaque. And if you are, I can tell how much plaque you're developing, and based on many studies that have been done correlating the results of a coronary calcium score with the risk of a heart attack, I can give you an indication of whether you're low risk, intermediate risk, or high risk. And once we understand where you are, then we can go back at your blood work and say, well, your cholesterol, it's okay where it is. Or, you know what, Marc, we need to bring your cholesterol down because what we see is that, you know, you're developing X amount of plaque. So we use these studies to individualize care. In other words, you and I might have the same level of cholesterol, but if you're developing a lot of plaque and I'm not developing plaque, we cannot be treated the same way. It doesn't make any sense.
Right. Understood. Okay. So, series of tests. I got real nervous. I got to be honest with our audience because Doc tells his basically the nurse, the assistant, well, what's going to happen, and I'm on a treadmill and I have these electrodes all over my chest, and I'm really nervous because I'm thinking I'm going to sprint until I pass out, and then I realized I didn't necessarily have to do that test. And I want to ask, why did you think that test wasn't necessary for me personally?
Yeah. So when we did your coronary calcium score, Marc, we understood that you had no plaque in your coronary arteries. That means your coronary calcium score was 0. Based on many studies that have been done, when you have a coronary calcium score of 0, no identifiable plaque in the coronary arteries, we know that your risk of having a heart attack in the next 4 years is about 0.3%. Very low. If I already know that you don't have any plaque in your coronary arteries, there's no point in me doing a treadmill stress test for you because that particular test only identifies plaque that is obstructing the artery 70% or more. If you don't have any plaque, how can you have one that is 70% or more obstructive? It doesn't make sense. So the best prevention study to understand what your risk is of having a heart attack in the future, it's not a stress test, is a coronary calcium score.
Awesome. And I was actually shocked to hear that it was 0. I was very happy, but shocked. Okay, understood. Doc, do you have these blood results in front of you?
I don't have them, but you can. I remember, for example, the one of the values that I remember for you is your LDL, which is the most important one. If I remember correctly, it's 117, right?
Yeah.
So that's the bad cholesterol. And so let's start there. If you have a bad cholesterol or LDL of 117, interestingly enough, as you are reading that, Marc, it's highlighted as if it was high, correct? Are you there?
Yeah, yep.
So, it's interesting because the lab will tell you that if you have an LDL above 100, that's high. Well, that's not the case because you are a low-risk individual. So an LDL or bad cholesterol of 117 is perfectly fine for you. And that's important because if you're only doing that blood work and you don't have the context and you don't have someone helping you understand them, you would have thought that you had a high cholesterol, but you don't.
Right. Thank goodness. Really, thank goodness. So some of my that were in red, my BUN was 32H.
Yeah. So I remember that too. If you look at your BUN,
You remember this? You're amazing.
I don't know, but if you look at your BUN creatinine ratio, that is going to be elevated in your case, and what that suggests, Marc, is that you need more hydration based on everything that you do. I mean, I know you do a lot of exercise,
Right.
All day long. So when you have a BUN creatinine ratio that it's a little bit elevated, like you did, that suggests you need to hydrate a little bit more aggressive than what you're doing. But that's not, that's a simple marker. That's not dangerous. It's just giving you an indication that perhaps better hydration would be better for you.
All right, perfect. And do you just pure water, electrolytes? What do you suggest?
Water. Water is fine. I think that for you, this is an interesting topic, Marc, because I think for you, if you're doing water and electrolytes, let's say with one of the sports drinks, probably for you it's okay because of the high level of training that you do. But if you take someone, even me, who is training relatively hard, but not as hard as you train, if I start drinking these sports drinks, it's just going to be too much sugar for me.
Understand.
But because you exercise as much as you do, it's probably okay. You know, you probably lose a lot of electrolytes, and that sugar, it's not going to matter for you. But if you get someone that goes to the gym for 30, 45 minutes and is walking on a treadmill, only walking, and you see them with a Gatorade or a Powerade or whatever brand, that's not a good idea.
Understood.
You know, they don't need that. They're drinking too much sugar when they do that.
Got it. Okay, perfect. My ALT 48H.
So that is ALT, it's a liver enzyme, and that goes along. That, by the way, just so people understand, 48 is very, very mild increase in terms of what the normal should be. I think the normal should be 42, 43. Correct me if I'm wrong, Marc, but you see it there. So at 48, it's only mildly elevated. And that goes, Marc, with the same concept. If you're somewhat dehydrated when you do that blood work, your liver enzymes can be a little bit elevated. Your BUN creatinine ratio could be a little bit elevated. So in your particular case, I don't think that is an important finding.
Got it. Okay. White blood cell count was 3.61.
That was a little bit low. That is something that you see relatively often. Most of the time, Marc, it's a matter of just repeating the blood work, and then you'll see a normal value. Sometimes if you're incubating, you know, let's say a virus, or if your immune system is fighting something, or if you're going through a viral infection, the white blood cell count can be a little bit low. Again, if you have a completely normal person like you are, without any significant symptoms, very athletic, then that just, you know, it doesn't become too relevant, quite frankly.
Got it. Okay. Sex hormone binding glob 82H.
Yeah, and yeah, so that's more. You might as well then mention if you can see it there, your testosterone level, right? Because that is when I do a workup for a man, I also look at the hormonal axis. So that means FSH, LH, which are the hormones that stimulate testosterone production by the testicles, and then you do the sex hormone binding globulin, because that gives you an indication also of how that system is working. I can't remember specifically what your testosterone was, but I remember it was very healthy.
Yeah, which one? So my total testosterone was 657.
There you go, and so that's a very, very good, healthy testosterone, right? And at the age of 46. And I suspect, Marc, that in your case, it has a lot to do with bodybuilding. People that lift weights, especially when you are doing a lot of legs, because that's a big muscle, right? Your testosterone goes up in your body. So it's a great way. People that are listening to this and they're saying, man, I wish I can increase my testosterone naturally, which I would recommend before getting into the whole supplementation thing, which is obviously perhaps a topic for another day, and it's complicated. But before you think about something like that, lift weights. Make sure you're at your ideal body weight and start lifting weights. That will naturally increase your testosterone levels. But in your particular case, you have a very healthy level.
Right. I do not let our audience know I do not do any testosterone replacement yet. I mean, if I get on my years and I absolutely need it, I would certainly consider it. But I've been lifting weights my whole life, and it's always served me well. And I think, as what Dr. Juan is saying, I really, really think that's a large part of it. I mean, I've been lifting weights almost every day my entire life, and I think, the benefits, I feel amazing after I'm done, and it's helped me tremendously.
So you don't take, Mark, you don't take a day off?
I'll tell you this, on Sunday, I'll do a little bit less, but my Sunday is based off of what I do on Saturday. So if I have a easier day on Saturday, I'll do a little bit more on Sunday. But if I have a challenging day on Saturday, I'll do something on Sunday, but something super mild, like very chill, where I'm breaking a sweat and then I'm backing off. And the only reason I do that is because I feel better. Psychologically, I feel better.
Yeah.
And that's really it. I mean, I understand. I'm in this rowing competition, and it's a rowing competition in the ski erg machine. And
I've seen that.
yeah, oof, man, it's brutal. This week's competition is 6,000 meters for time, followed with no rest, followed by 1,000 meters for time. And it's pretty brutal, but I know when I need a break. Like, I just know that my system can't produce a top-end effort like that every day. And of course, the audience would say that's a no-brainer, Mark, but although we know those things, we try. And then you realize when you don't get your best. So I've learned to, if I want to do my best on Wednesday, I have to do a little bit less on Tuesday. I've learned that. I used to try to break a record every day. I know it sounds ridiculous, but that's the ego, really.
Yeah, and you know what? For people, watching this and listening to this, as a physician, I have to tell everyone, so Mark is a genetically privileged man. So you guys, it is true, right? So when we work out, let's make sure that, we're not injuring ourselves, because we can, the reality is everyone needs to compare himself or herself to you. I mean, not to Mark, but to yourself, because we should try to get to our limit, not to someone else's limit. It just doesn't work like that. You can perhaps work out every day, you feel great, and someone else might work out every day and get injured.
Right.
So it is important for everyone to determine, what's the max for them. I actually usually I take a day off, and what I do is I play golf that day, or I try to play golf that day. But I like training 5-6 times a week.
And on your day off, you just you feel good about allowing, of course you feel good about allowing your body to rest. I understand that. But psychologically.
No, I get antsy. Psychologically, yeah. I'm already thinking about Monday's workout. Mm-hmm. But I just know that if I work out 7 days, I think it wouldn't be beneficial for me. I think I would probably injure myself.
Mm-hmm. Understood. It happens too, because the body is expecting that rest. You're not giving it, and you're asking for more. It's almost the actual warning sign to tell you to back off. It happens frequently. It really does, as you said. Understood. Thank you, Doc. So now we've covered the blood work. I'd like you to, if someone's listening to this, you're going to give them your best list, maybe top 3 or top 5 things, preventative actions that people can take just to ensure good heart health. I know people have history, they have contraindications, they have a long list of family history. What can people do, if you had to give me 5 things, Doc, for preventative actions?
It's actually not the theory. It's very simple. What's difficult is actually implementing these things in a consistent way. But the data is very simple. Number 1, maintain an ideal body weight. it from an academic standpoint, it's very simple, but study after study after study has shown that if you maintain your ideal body weight and you reduce abdominal fat, you are significantly reducing cardiovascular risk. So that's number one.
Okay.
Number two, do at least the 10,000 steps every day. You don't have to take that advice literally, because I don't think that I do 10,000 steps every day. I actually don't count because I exercise a lot. You know, I go to the gym almost every day and I do a balance of cardio and weights. So, you know, I don't need to count steps. But if for people that are actually saying, well, you know, my exercise is I walk. That's what I do. I'm always active. I hear these all the time. I'm always active. Okay, then at least make sure you're taking 10,000 steps. And if you're a 45, 40-year-old guy or woman and you're completely healthy and all you're trying to do is 10,000 steps, where you're not being ambitious enough. You know, the other thing I hear constantly, Marc, is, yeah, I walk the dog. Walking the dog, well, I don't know what dog you have, but mine stops every 30 seconds.
Yeah.
You know, so walking the dog should not count. I mean, that should count when we're 80,
right?
Because that's great, right? When we're 80, we're active, but not when we're 40 or 50 and you're healthy. The third one would be, you have to sleep the 7 or 8 hours a night. If you start sleeping less, it increases your cardiovascular risk. It actually makes you gain weight, so you don't want to do that. Number 4, I would say, and again, it sounds simple from an academic standpoint, but it's difficult to implement. You have to have strategies to control stress, whether it's meditating, or whether it's yoga, or whether it's exercising, or whether it's dancing, swimming, reading, writing, whatever it is. I don't care. But you have to have something that you can invest 30 minutes, 45 minutes daily, that it's going to help you control your stress. And number 5 would be, you have to be very conscientious about what you put in your body, right? So smoking or vaping or food, you know, the food that you're eating, anything that you put in your system, in your body, can increase the risk of cardiovascular disease. A little bit more controversial, but I think we should mention it because of the audience that you're going to have. Energy drinks. Be careful with energy drinks.
Thank you. Please.
You know, for most people, it's probably nothing, and the energy drink it's not gonna do any harm. But there are reports and data that suggest that energy drinks could potentially increase the risk of arrhythmias, and there is some data that's starting to support that in some people it might cause even heart attacks. So you have to be careful with energy drinks. Like I said, I don't want to sound like I'm exaggerating, but it's the same as smoking. A lot of people smoke, and only 8% of the people who smoke get lung cancer. But if you're in that 8%, you're not going to like it. You just need to be aware of that association between some cardiovascular risk and energy drinks.
Understood. I know it's a big topic, but we're talking about energy drinks, and how do you feel about a little bit of caffeine before training? Not like, we don't need to get into the breakdown of well, we know what it does, but are you okay with that? Like a shot of espresso, a cup of coffee. How do you feel about that?
I don't have a problem with that. Coffee's healthy. You know, as long as you're not taking more than 400 milligrams of coffee in a day, you are completely within the range that have been studied, number 1, to be safe, and number 2, beneficial for your heart, for your brain, for your liver. And that's because of the antioxidant capacities or elements of coffee. Now, when we say coffee, you also have to define what is coffee for you, because, you know, if you're taking the Cuban coffee that it's, you know, I don't know how much sugar they put into that thing, but it's a lot of sugar, then that's not going to be good. Or if you're the type of person that thinks of coffee as a white chocolate mocha from Starbucks, you're basically drinking a dessert before you work out.
Right.
So if it's a cup of black coffee or like you said, a shot of espresso, you know, As long as you're not doing more than the limit, it's healthy.
Understood. Understood. That was super helpful. Thank you very much, Doc. Are there any, I'd say maybe dangerous things that you've seen trends in regards to exercise other than, the energy drinks? Are there any forms? I know it's all, everyone's very different. I understand that. But have you heard of anything in exercise, any events, any specific types of weightlifting that, you've heard you really need to be mindful and careful of these things?
Yeah. I think that if you are above the age of 40, like I am and you are, you have to be careful with anything that resembles or is like CrossFit. The reason why I say that is because, not because it's necessarily bad. If you're doing it under supervision and so forth, it can be very, very good. But a lot of injuries that we see are from CrossFit. And the reason why I think this happens is because you have a group of people and you're doing it at the same time. And to a certain extent, you're competing with each other. Sometimes, you see the, there's some sort of board or whatever where you can see where you are in relation to other people. And what ends up happening is that competition can lead you to bad form. And if that's the case, you can end up injuring yourself, especially if you're above the age of 40. You have 20-some-year-olds doing, CrossFit, and very rarely will they get injured. No matter what they do, they're going to be fine. But above the age of 40, you need to start being a little bit smarter about how you train. And if you're going to do that type of training, I think you're better off doing it with someone who's supervising you, someone who can help you, whether that's a trainer or a very good friend, and you're paying attention to each other, and one can say, hey, by the way, Juan, you're losing the form. Be careful. You might, you don't want to injure your back or whatever it is. So I think that any of those situations in which you're either competing or quickly moving from one station to the next, I think that unconsciously that puts a little bit of pressure on us to do it quickly, and that can lead to bad form and injury.
Understood. Well, this has been amazing. I can't thank you enough for your time, Doc. You're incredible. Thank you for, in your busy schedule, for taking the time to come on. It's going to be very impactful for the audience and our listeners. I really can't thank you enough, and keep wearing the incredible, incredible suits. I hope to see you at Carbone again, because I'll be eating the pasta as well.
Absolutely. Listen, if you guys do the right thing, you can enjoy life. It's all about balance. I believe it. And, not only the pasta, but I'll have a tequila with you. I hear that that's good for the arteries.
That's what I hear.
Thank you so much, Marc. I appreciate the invitation. I admire what you do, and keep it going. Hopefully we'll be having these conversations feeling like we are feeling today.
You are the best.
We're 70.
That's right. That's right. Awesome. Thank you, Doc. Have a great holiday season, and please give my best to your family.
Thank you. Likewise.
Take care. Thank you.